Hi, this is Kelly Grisham, and this is Meaningful Use. Meaningful Use is using electronic health record technology to improve quality, safety, efficiency, and reduce health disparities. In an attempt to modernize infrastructure, the United States government passed the American Reinvestment and Recovery Act, or ARRA, in 2009. One measure under the ARRA, the Health Information Technology for Economic and Clinical Health, or HITECH Act, proposes the meaningful use of interoperable electronic health records throughout the United States healthcare delivery system. Believing the health information technologies could bring more efficiency in healthcare and improve patient outcomes, they provided incentives for hospitals and healthcare providers to adopt health IT. The goals of meaningful use were strongly supported by consumers and purchasers when the program was enacted. The program, once fully implemented, would benefit both patients and eligible providers by increasing healthcare coordination and fostering better doctor-patient communication. With increasing use of EHR, meaningful use aimed to reduce medical errors and improve patient safety. Other goals of meaningful use were to support delivery of evidence-based care, reduce disparities by recording demographic information, advance payment reform, and provide patients with their own portable health information. In order to prove objectives were being met, the Centers for Medicare and Medicaid Services outlined rules for each stage of meaningful use. For healthcare practitioners to receive the incentives, the rules must be met. Rule requirements have been divided into an initial 15 core set objectives and 10 menu set objectives. EPs were required to report on 13 core objectives and 5 of 10 menu objectives in Stage 1. For Stage 2, CMS added additional objectives, and EPs were required to report on 17 core objectives and report on 3 of 6 menu objectives. In 2015, CMS amended the rules for meaningful use, and all providers were required to attest to a single set of measures and objectives, as you see before you. There are 3 stages of meaningful use. Rolled out in 2011 and 12, Stage 1 focused on electronically capturing health information in a standardized format that could then track key clinical conditions. With the standardized format, communicating the information would improve the care coordination process and engage patients and their families in their care. Clinical measures and public health information would also be reported more easily. Stage 2, implemented in 2014, required more rigorous health information exchange and increased requirements for e-prescribing and incorporating lab results. Electronic transmission of patient care summaries across multiple settings was set to increase, and patients were to have more control over their data. The final stage, Stage 3, was implemented in 2016 and focused on improving quality, safety, efficiency, leading to improved patient outcomes and improving population health. Goals also included decision support for national high-priority conditions and increased access to comprehensive patient data through patient-centered HIE. The Meaningful Use Incentive Program ended in 2016. However, a new program has taken its place. Advancing Care Information, part of implementation of the Medicare and CHIP Reauthorization Act of 2015, or MACRA, has continued to offer incentives and promote the use of EHR. The new program is similar to Meaningful Use, but has changes in its approach. No longer is credit given on an all-or-nothing basis. Half credit can be given by simply attesting, and the performance scores are based on percentages. The Meaningful Use Stage 3 rules carried over to MACRA implementation, and with some adjustments, providers had complained that certain measures of meaningful use were not pertinent to their practice or required data entry button pushing that were not always relevant to a patient visit. In advancing care information, eligible professionals will be able to select measures to best fit their practice. CMS provides payments to eligible practitioners and hospitals via the EHR incentive program over a period of years if they demonstrate meaningful use of EHRs. The program was created because EHRs represent the electronic infrastructure driving healthcare quality and efficiency improvements and are foundational to the healthcare delivery payment reform needed for healthcare transformation. The incentive program payments range. For Medicare providers, they range from over $44,000 over 5 years, and for Medicaid providers, $63,750 over 6 years. Participation in the CMS EHR incentive program is totally voluntary. However, if eligible providers or eligible hospitals fail to join by 2015, there will be negative adjustments to their Medicare and Medicaid fees, starting at a 1% reduction and escalating to 3% by 2017. Meaningful Use has had mixed reviews. Some providers have benefited greatly. Others were frustrated by the lack of flexibility and poor interoperability of the EHR. It appears CMS has listened. With the changes in reporting and increased flexibility, EPs have more options to customize the system and meet their needs, in turn allowing for better care and provided improved patient outcomes. There is still room for improvement, as patients have had difficulty merging information into one place, with some healthcare being provided between multiple groups who utilize different EHR software. Progress takes time, and with Meaningful Use and the EHR incentive program, healthcare has made huge advances. Thank you for joining me.